Hey guys, my name is Dr. Dimma and this is the part 2 video of our Mounjaro series. I'll be discussing what people do not tell you about taking Mounjaro. So we talked about what Mounjaro is. That is tirzepatide. It is part of a family of GLP-1 agonists that help reduce your need to eat. They curb your appetite and make you feel full, and that is how this drug does its wonders. But people do not discuss the side effects and how to get the best out of using this drug, and that is what we'll be talking about in this video. The link to the first video is in the description box below, so please go and watch it and catch up with all the information on Mounjaro. So going quickly, what are the side effects when people are using Mounjaro? The work that Mounjaro is meant to do in your body is to make you feel full. Now when you feel full and you still try to eat, that is when you can experience nausea, that is a feeling of vomiting, or actual vomiting, or feeling bloated, or having indigestion, because this medication slows down how your body processes food quickly. So all this culminates in the GI side effects, which is gastrointestinal side effects. You feel bloated, you feel like vomiting, you eventually vomit, and you have indigestion. And the worst part is if you were to belch them, because all the food is there waiting. The belch sometimes smells like rotten eggs. That is why while you are on Mounjaro, you need a lot of discipline. Because if you keep feeling that you can eat anytime you like, you're going to feel miserable. That is how the drug works. So please take note of these side effects. So this other group of side effects is what I call the general side effects of Ozempic. So because you're not eating as much as you want to eat, it means that you will have low energy levels. You can experience dizziness, you can experience confusion, you may be dehydrated, and this dehydration, if it is very severe, can give your kidney problems. Remember, the kidney is what produces urine. It cleans out the dirt in the blood and produces urine. So if you're not drinking enough water, you can understand how that can affect the kidney. Other side effects that people complain about is hair loss. Remember, Mounjaro is not allowing you to eat as much as you want, and all these parts of our body are sustained with nutrients, so you can experience hair loss, can experience muscle loss, and that's why people say there's this Mounjaro face where they lose so much weight and they're looking like shriveled and shrunken. So that happens because they are not following the technique I'll be explaining later to get the best out of this product. The other set of side effects I would like to talk about is the side effect that affects specific organs. For those that have a tendency towards thyroid issues, Mounjaro can cause thyroid cancer. For those that have issues with the pancreas, even those that do not have, Mounjaro can cause pancreatitis, which is inflammation of the thyroid. And for the kidney, if you take it too far by not drinking enough water, Mounjaro can actually cause acute kidney injury, which is a problem with the kidney because of severe dehydration. So these are the side effects that one can experience due to Mounjaro, but these are rare. The ones that are common is that feeling of indigestion, bloating, or feeling like vomiting, and that's basically how the drug works. Those other severe ones are very rare, especially when you compare it to Ozempic, which is why Mounjaro is a better drug. These side effects are more in Ozempic. You will feel more miserable while on Ozempic compared to Mounjaro. So that being said, let's get into getting the best out of this medication while you are on it. So to get the best out of your Mounjaro use, I have outlined these strategies that will help you. The first one is to decide to use Mounjaro for an adequate duration. Now, this medication is hormonal. It's going to work like a natural hormone in your body. So if you just do 1 month and then you scoot and you go away, you won't get the best effects. There is something called rebound weight gain after Mounjaro. If you have used it for a duration and you stop, that weight you lost, you are likely going to gain back, if you're not careful, 2/3 of that weight. So you need to plan to use Mounjaro long enough so that you would have made the lifestyle changes you need to sustain the results. So to get the best out of it, you need to plan to use Mounjaro longer than 3 months. For all our patients who are preparing for plastic surgery, the duration is 3 to 6 months, so that you would have not just lost weight, you would have changed your lifestyle. Those things will now be part of you. They say what you've done for 21 days is a habit. Now imagine doing it for half a year. It will be easier for you to sustain those results and avoid rebound weight gain. So first, plan to use it for that duration that is adequate for you. Secondly is mental preparation. You have to prepare to use this medication, because first you feel full, then you're nauseated and irritated by everything around you, and sometimes you vomit, you feel dizzy, you're confused. There is these expected side effects of the medication. That is how it works. So you have to prepare your mind that after you take this jab, for the first 3 to 4 days after, you experience these things, so that you'll not be like some of my patients that chicken out and say, I'm not taking, it's too much, I can't do this. You have to prepare. That mental preparation helps you understand that you're not just planning to lose weight, you're changing your life for the better. You're doing this to get into a healthy lifestyle, eating healthily. This is respect for yourself and your body and your health. That is what you are trying to achieve. So that mental preparation is important. It's not just about having the money to afford it, because it is pricey, but if you want to sustain those results, you need to prepare mentally. This next strategy on how to get the best out of taking Mounjaro is called the diet. Now, some people, you hear them saying, oh, just take Mounjaro, you don't even need to exercise, don't need to diet, just eat the way you want. I don't even know what Mounjaro they're taking, because normally you can't eat the way you want to eat. But despite that, you need to have a plan. So what most people do is that they will do intermittent fasting, which means they won't eat all the way around the clock. The only time they eat is between 12 and 4, and then they take 1 meal a day. That is a plan. However, that 1 meal a day, if it is not nutritious enough, if you don't have the right proportion of nutrients, you still won't be getting the best. So we recommend a low carbs, high fat, adequate protein diet. Even if you're doing 1 meal a day or 2 small meals at any time you want to do it, make sure that it is low carbs, high fat, adequate protein. That protein is important, because that is what will stop you from experiencing side effects like looking shriveled or shrunken and then losing your hair. So stock up on protein bars, buy your crates of egg, stock up on protein shakes, eat meat, fish, eggs, turkey, all those things. Still eat your proteins well. That is what will help you get the best in terms of diet. And the next strategy is physical activity. Being on Mounjaro doesn't mean you won't exercise. You may not have all the energy to lift all the weight in the gym, but you should still walk, swim, skip, do light activity consistently 3 to 4 times a week. All this will accumulate in you achieving good results at the end of each month. So still indulge in some physical activity. It will also keep your muscle tone. Remember that Mounjaro is making you not to eat and have enough nutrients. So physical activity will keep those muscles toned, in addition to taking adequate protein. These two things combined are very powerful strategies on getting the best out of taking Mounjaro. Another strategy I'll discuss is adequate hydration. So I know that you don't even have space for food, and when you drink water you feel like vomiting. So I will say, for your fruits, your juices, all those things, you can drink your food. I would say it's better to drink more than you eat while on Mounjaro, because your body will process the fluids faster, and it will nourish the rest of your body, prevent you from being dehydrated and having kidney issues. But if you just eat small and now you don't even have space to drink water, can you see where the constipation comes in? Can you see where all those digestive issues come in? So when you eat a little, drink more, and you can make it nutritious drinks like your protein drinks, fresh fruit juices, electrolyte water, not just bland or plain water. More food, drink more, so that things move smoothly in your system, and then you avoid kidney damage. Now, like we said, you're not eating all the nutrients you want to, so there's need for supplements, there's need for micronutrients. So for many people, instead of buying different pills and your house is full of these supplements, a lot of things, I will encourage women to take the pre-pregnancy vitamins or the Pregnacare. That contains enough vitamins to nourish you and a baby. So many times, and it's one big tablet, it's easy to be compliant. So once you take that, all the micronutrients you need will be in your body, and you are supporting your system this time that you are not eating adequately. So you need supplements to support yourself, to give yourself the adequate micronutrients. And then finally, don't just go and buy Mounjaro and take it anyhow. Nobody is monitoring your blood levels. Nobody is looking at your labs interpreting how this drug is dealing with you. So it is important to be in a physician is doctor monitored program. Let a doctor be in charge of you taking this product. Don't just go on a website and maybe talk to a nurse or a spa or anybody and just buy. Let a doctor be involved in your therapy so that from time to time you run blood tests and then we go over your labs, where you started and where you are now. That is the benefit that all our clients in our programs enjoy. We follow up on them, the nurses follow up on them, I follow up on the patients as well. So join a program where a physician or a doctor is in charge. And finally, sometimes we have the ability of connecting those on weight loss journeys together so that there is peer support. Some of us on the team are also using the medication, so there is peer support, there's accountability. You're not walking alone, you're not doing this alone. And that is why it is important for you to join a program where we'll give you dietary plans, we provide ongoing psychological and emotional support for you as you go on this journey to transform your life positively. So these are the strategies I wanted to discuss with you so that you can get the best out of taking this medication called Mounjaro. Remember that if you experience any of these side effects, you can quickly revert back to the team and we will address it for you. Now, do you want to have a consultation to get started on your weight loss journey? The link is in the description box below. So if you watched the video to this extent, thank you. Thank you for subscribing because we know you will. Thank you for following and sharing our content. Most importantly, the comments are gold to us. Please drop a comment in the comment section and we'll see you in the next video. Bye.